Today we are going to study about clavicle. You can see over this structure is what this structure over here is clavicle. Okay, now with these things we will be moving forward. You can see the bone structure, long bone over here, that is humerus. The bone structure over here is this is what this is scapula. Okay, now let us remove this structure. Let us remove this structure and let us focus on the clavicle. Okay, now what actually clavicle is? Talking about peculiarities of the clavicle. Uh, this is the first one to ossify except in its medial end. Long bone in its what? Long bone which is in horizontal direction. There is no bone marrow, there is subcutaneous throughout, and we can divide this bone structure, we can divide the shaft into three different part. What happens now? Let us what happens, let us right over here. What happens, you can see over here, we can divide it into three part. What happens, this is what this is medial to third, and this is lateral one, and this is junction between and these two structure, these two part. So this division is more important because mostly the fracture site will be in this structure. If any abnormalities go over here, what happens, there will be fracture, and what happens, our treatment approach will be accordingly. Okay, now let us talk more about clavicle. And you can see over here, this is the medial in, this is the lateral in. Medial in is what? Medial in makes in joint with what? Joint with sternum, that is called as what? Sternoclavicular joint, and this makes an joint with acromion process of the scapula. That is what that makes, and joint that is a makes a joint, that is what? Acromioclavicular joint. Okay, now talking more about the clavicle. And you can see medial in and lateral in. I've already mentioned about these things, and now let us divide these things into let us look from anterior aspect. You can see over here what happens, the anterior aspect, anterior medial to third is what? This is convex, and the lateral side are what? Lateral side are what happens, they are convex. Okay, now let's talk about the muscle attachment over here. And muscle attachment over here, so let us approach through the what happens, approach through the these things. Okay, so what happens, so what happens from the what gets insertion over here? Okay, trapezius get insertion over the upper aspect. Okay, and the trapezius and this posterior, and another one mainly on the trapezoid tubercle, on mainly on the posterior or inferior aspect, and the deltoid get originate from these things. Okay, deltoid get originate from these things. You can see over here. Okay, and the sternocleidomastoid, and from the medial to top of the shaft, you can see most of the pectoralis from the anterior surface give origin to pectoralis major. Okay, pectoralis, what happens, pectoralis major. Okay, and the half superior surface give origin to clavicular head of sternocleidomastoid. This the clido over here, the term is clavicular. Okay, and the oval impression of the inferior surface of the medial in gives attachment to the costoclavicular ligament. Okay, so you can from the inferior aspect, you can see over here, okay, this is soft clavin group. Okay, and the oval impression of the inferior surface at the medial in give what happens, give attachment to the costoclavicular ligament. Okay, and the soft clavin groups give insertion to the soft clavus muscle. This also give insertion to the soft clavus muscle. Sometimes soft clavin supraclavicular nerve passes over here. Okay, now these are the main things. And what happens, talking about ossification, this is the first bone in the body to ossify except in its medial end. So what happens, it has two primary center. What happens, there are two primary center and one secondary center. Okay, and it fuses on 45 days. Okay, and secondary primary center fuses at 45 days, and the secondary center fuses at 15 to 17 years. Okay, and appears at during 15 to 17 years, and fuses during 21 to 21 years. Okay, occasionally there may be a secondary center for acromion. Now this with this thing we have already talked about clavicle, and we have already talked about the these things. And you can see over on the inferior aspect, you can see this is what conate tubercle. This is conate tubercle. Okay, this is conate tubercle. Now let us pin this structure. Okay, what happens, let us pin this structure, and let us talk about. Okay, now what happens, this is we have already mentioned what is this is acromion. This is conate tubercle, and the inferior aspect, you can see this is what acromion facet, this is what trapezoid line, and this is soft clavin groove, this is conate costal tuberosity, and this is sternal line, this is sternal facet. With this thing we have already talked about this normal anatomy. Now let us talk about clinical anatomy. So clinical anatomy, the clavicle mostly fracture on the outstretched end. We have already mentioned. Okay, and the clavicle may be congenital absence or imperfectly developed in a disease called clido. The term clido is for what happens. Clido is for what? Clido is for cleidocranial dysostosis. Okay, correct. Cleidocranial dysostosis. Okay, these are the normal things. So let us summarize these things. So we have already mentioned, we have already talked about the clavicle. So what happens, clavicle is the clavicle is what? Clavicle, let us talk about clavicle. Okay, again let us revise the clavicle. Clavicle has two in, that is medial in and lateral in. It has it has shaft. Shaft can be divided into three parts, mainly three parts. What happens, medial two third and lateral one third, and the function between medial one two third and the lateral one third. So what happens, on this basis, what happens, there will be the fracture. Okay, fracture, and the treatment approach will be accordingly. And this is the only bone which has two primary center, one secondary center. It is subcutaneous throughout. It is the first one which is ossifying. I have already mentioned. It is the only wrong one which ossifies in membrane. Okay, this is the, it consists, it may have, it has what happens, it has membranous ossification, and there is no medullary cavity. Sometimes it is pierced by supraclavicular nerve. Okay, and with this thing attachment, what happens, trapezius, where the trapezius get inserted, where the deltoid get where the trapezius gets inserted, where the deltoid get originate, and we can have to know about the costoclavicular ligament, and we have to know about the sternocleidomastoid, what is the origin, where the muscle get originated, sternocleidomastoid. Another one is what? Another one is pectoralis major. Okay, soft leibes vessels, and anything so you can mention in the chat box. Okay, with these things I have talked about the clavicle. If any query, I will be talking later. With these things, I have completed on the topic clavicle. If any query, this is my first video. If any suggestion, I will be working throughout, and I request my senior everyone to suggest me and to correct me.